Hello students, welcome back. Just recollect what comes to your mind looking at this picture. I shall add one more picture. Yes, you are right. Here it's fight between Bhima and Duryodhana. Duryodhana finally died when Bhima hit hardly on his thighs. Because whole of his body was steel-like, this became because his mother looked at his naked body. But because of Krishna's intervention, he didn't go in front of her naked. That's how Duryodhana's life lied in his thighs. This was well-known mythological story of India. I have some connection to tell a story like that in this class what we are going to learn today. Let us look at posterior compartment of leg. These are the learning objectives for the session. Mentioning the different muscular compartments of leg, enumerating muscles of posterior compartment of leg, explaining these muscles in detail, that is their origin, insertion, nerve supply and action, briefing the tibial nerve and posterior tibial artery, which are main neurovascular structures of this compartment, describing the flexor retinaculum, which is just behind the ankle joint on the medial side in the lower part of the leg, and mentioning few of the related applied anatomical aspects. So let's begin. Muscular compartment of leg is shown here in transverse section. You can see here this is tibia, which is subcutaneous bone, and this is fibula. This is anterior side, this is posterior side, this is medial side, and this is lateral side. We are seeing anterior compartment between the tibia and fibula here, and this is the lateral compartment just lateral to the tibia, just lateral to fibula, and this whole of this is posterior compartment, which is having muscles in two layers, that is superficial and deep. So that's why there is deep facial septa shown here. So whole of this is posterior compartment of the leg, which is largest compartment compared to other two in leg. These are the muscles filled here. You can see skin and superficial fascia, which is yellow colored fat filled. This is subcutaneous tibia, anterior compartment, lateral compartment, and whole of this is posterior compartment. What I want you to observe here is neurovascular structures. Main neurovascular structures are here in the deeper aspect, and bulkiest muscle here on the superficial in the superficial group, and in the subcutaneous structures you are seeing a major vein, that is small saphenous vein on the posterior aspect, and just beside that sural nerve. Let us enumerate muscles of the back of leg. As I told you, they are divided into superficial and deep groups. Superficially, we find gastrocnemius muscles. So these are the gastrocnemius muscles too. They are two having two heads. They unite together to form single belly. And below that, the bulkiest muscle, this is soleus. And in between these two, we find here it's a tendon of plantaris. Just like palmaris longus, thin tendon, we find plantaris muscle between these two. We'll be looking at them in detail in a while. I'm just enumerating and locating where they are. These are the deep group of muscles. Popliteus, which is not shown here in this picture, which is much higher up, just near the knee joint. When you see between the tibia and fibula, this is deep part of that is tibialis posterior, and very near to the tibia, this is flexor digitorum longus, and very near to the fibula, flexor hallucis longus. Tibialis posterior, flexor digitorum longus, and flexor hallucis longus. As the names say, gastrocnemius is like gastrium or belly shaped, soleus is sole shaped, and plantaris is homologous to palmaris longus, and Popliteus is very near to the popliteal fossa. Pop means back of the knee, and tibialis posterior very just behind tibia, just like tibialis anterior. And other two muscles are doing flexion of hallux and flexion of digits, which are longus, which are extrinsic muscles for foot. This picture shows superficial structures just below the skin. Chiefly we have seen it in cross section. This is short saphenous vein. Along with that we are finding sural nerve. These are the important things one has to observe during dissections after removal of the skin before opening the deep fascia. Before going to muscles in detail, let us look at the skeleton. These are tibia and fibula articulated. These are the markings on them to show red and blue colored origin or insertions of different group of muscles. This is magnified view of the same. Just to tell you where gastrocnemius takes origin. So this is medial and lateral head for gastrocnemius. See, this is medial, just above the medial and lateral condyles of femur. This is medial head and lateral head of gastrocnemius. Just above the lateral head of gastrocnemius, plantaris muscle takes origin. You would have learned that when you were learning about the boundaries of popliteal fossa. Both these heads come down and they join together. Along with soleus, they form triceps sura. Triceps means three heads, sura means like triceps, sura is muscle belly completely formed by both heads of gastrocnemius and soleus. I am just showing you origin of gastrocnemius. Now let's move on to origin of soleus. You can see just behind the tibia, so this line you can see soleal line. So this is the linear origin. So this is origin of soleus on tibia. Not only here, even the head of the fibula and also posterior border of the fibula. This inverted U-shaped area, whole of this is origin for soleus. So gastrocnemius and soleus. Along with that, we are seeing here plantaris as well. So I am just covering these three muscles of superficial region in the first go. Here I am showing you the origins as well as the insertion. So all these muscles, both heads of gastrocnemius and whole of the soleus bulkiest muscle, these superficial muscle, they are joining together to form a common big tendon which is just above the heel on the posterior aspect, that is tendocalcaneus. So which inserts on the calcaneum, posterior border of the calcaneum. This is the insertion of triceps sura. So let us look at those muscles. So superficial muscle, this is medial head, this is lateral head of gastrocnemius. Along with that, plantaris also is seen, and both of them are covering on the soleus. Soleus is not seen here. To look at the soleus, we have to break open the gastrocnemius. So here it has been done. So gastrocnemius has been cut here and origin are shown here, and plantaris is shown, which is having long tendinous just like palmaris longus of the forearm, and this is sole shaped soleus. You can see this is the origin of soleus and it is coming down. All these three muscles except plantaris, these three bellies, two heads of gastrocnemius and soleus, are joining together to form tendon going towards calcaneus. We call it tendocalcaneus. So this is strongest tendon of the body. Whole body can be hooking around this tendon, which was done to torture the soldiers in olden days. Even in butcher shops, we can see whole body of animal will be hung on this tendon. That is, in humans it is tendocalcaneus. This is also called as Achilles tendon. There is a very nice, interesting mythological story for this. I am again showing you here. These are the roots of gastrocnemius. This is the belly along with soleus. This is Achilles tendon, tendocalcaneus. So when these muscles, gastrocnemius and soleus, they contract, So they gastrocnemius are crossing the knee joint. They are weak flexors of the knee joint as well. Chief flexors of the knee joint are hamstring muscles, back of the knee muscles, but gastrocnemius is also crossing knee joint among the back of the leg muscles, plantaris, even plantaris. So these are weakest flexors of the knee joint, gastrocnemius. Chiefly, along with gastrocnemius and soleus, they pull the heel upward like this. So the contraction will pull the heel upward, then it causes toes to go down like this. So they do plantar flexion. So this will raise the whole weight of the body. So this is the action of soleus and gastrocnemius. They are chiefly plantar flexors. The nerve supply is posterior tibial nerve, branches from the posterior tibial nerve. This is about superficial muscles. Even plantaris is doing this, but it is a very weak muscle. It is homologous to palmaris longus. So let us look at that interesting story, why we call it as Achilles tendon. In Greek mythology, there is a hero, great warrior. His name is Achilles. When he was a baby, his mother thought that he should be immortal, and she prayed and she dipped whole of his body into a holy river. The name of the river was Styx in Greek. Into that, she dipped him, holding at his ankle, just above the heel on this Achilles tendon. She had it and she dipped him in holy river of Styx, and he became immortal. The story says like that. Just like Duryodhana, how his life lied in thigh, the life of Achilles lied in his tendocalcaneus. So he finally dies when an arrow hits him on this tendocalcaneus. You can see many such monuments, sculptures of Achilles in Greece. Even Hollywood movie is there on these lines, that is Troy. When gastrocnemius and soleus are compared anatomically and physiologically, gastrocnemius is white variety of muscle, which is like a top gear. The contraction goes rapidly and strongly, but it cannot be sustained for a long time. That's how it goes to fatigue very easily. Whereas soleus is having red muscle fibers, which is like a low gear. It is also known as postural muscle, which helps in standing for a long time because it is not going easily for fatigue. Now let us look at the attachments of deep group of muscles. Here is the origin of Popliteus, that is just above the soleal line on the back of the tibia. This triangular area is origin for Popliteus. It goes up and laterally and it inserts just below the origin of lateral head of gastrocnemius on the lateral condyle of femur. Actually, the tendon of Popliteus passes through the capsule of the knee joint. It has intracapsular attachment. Some books mention that its origin and insertions are vice versa. That is also true with respect to its action. The Popliteus is supplied by tibial nerve, and action of Popliteus is unlocking of knee joint. Just below the origin of soleus, here in the interosseous membrane region and on the tibia and on the fibula, we find origin of other three muscles. Tibialis posterior is having most bulkiest origin here, which is on the tibia as well as on the fibula and also on the interosseous membrane. And on the tibia, just beside the tibialis posterior, we find origin of flexor digitorum longus muscle. And on the fibula, just beside tibialis posterior, we find origin of flexor hallucis longus muscle. Flexor digitorum longus, flexor hallucis longus, and tibialis posterior. This picture shows a complete popliteus muscle. Let us look at other muscles where they are going to insert in the foot. Tibialis posterior, from here it descends down medial to the calcaneum and it enters the sole. Its insertion is on the navicular bone. The slip of insertion also extend on all other tarsal bones except talus. Flexor digitorum longus, which descends down and it runs laterally to insert on the plantar aspect of base of distal phalanx, lateral 4 distal phalanx. Though this is flexor digitorum longus. Though the origin of the muscle is on the medial bone, the insertion is on the lateral 4 digits. Just like that, flexor hallucis longus is here taking origin, and it is descending down to medial to the calcaneum, and it inserts on the uh, plantar aspect of the base of the distal phalanx of great toe. So though this muscle is on the lateral aspect, the insertion is on the medial finger. We are looking at extrinsic muscles of the foot in the posterior compartment once again. This is tibialis posterior, which is seen here. This is flexor digitorum longus, flexor hallucis longus. So when we look at these muscles in dissections, flexor hallucis longus will be having bulkiest mass, because flexion of the great toe is more stronger than flexion of other 4 fingers. You can check in your own body now. Flex great toe forcefully towards the ground. That is more forceful than flexing only lateral 4 fingers forcefully to the ground. That's how this will determine which is the strongest muscle. Flexor hallucis longus will be the strongest muscle. And flexor hallucis longus lies on the lateral side. Though it lies on the lateral side in the back of the foot, it is inserting on the first digit. That is, we count it from the medial side. You can see here, this is flexor hallucis longus, which is coming down and insert. This is the tendon, and which is inserting on the hallux. And this is tibialis posterior, which is having insertion on the navicular bone and extension slips to the other tarsal bones. And flexor digitorum longus is here. Flexor digitorum longus crosses the tibialis posterior from medial side. It is the medialmost muscle in the back of the leg in the deep group, right? Flexor digitorum longus, from the medial side it crosses flexor tibialis posterior first, and then it crosses flexor hallucis longus, and it goes lateralmost to the lateralmost place and inserts on the plantar aspect of base of lateral 4 digits in the distal phalanges. Same muscles with added neuroascular bundles with different pictures, and how they cross the ankle joint below the flexor retinaculum and travel to the sole. This is flexor digitorum, medialmost muscle, crosses tibialis posterior first, and then crosses flexor hallucis longus next, and lies in the most lateral part, goes to lateral digits. This is posterior tibial nerve, and this is posterior tibial artery. Tibial nerve and posterior tibial artery. So they are also here. So in order, just below the flexor retinaculum. Flexor retinaculum is modified deep fascia, which is holding all these tendons enclosed in synovial sheath in place, preventing popping up during contraction. So this is the first muscle. This is tibialis posterior, because it has been crossed by digitorum, flexor digitorum. Tibialis posterior, flexor digitorum, then artery and nerve, and then flexor hallucis longus. This is the order of muscles below the flexor retinaculum. We shall look at it in detail in next slide. This is left foot showing flexor retinaculum, below which all these structures, the posterior compartment deep muscles, are passing to the sole, as arrow shows. So these are the things, and they have order in their arrangement. The first is tibialis posterior, and next is the initially crossed muscle, that is tendon of flexor digitorum longus, and then artery, posterior tibial artery, and then nerve, tibial nerve, and finally flexor hallucis longus, which yet it is not crossed by digitorum. And the order of arrangement can be remembered by mnemonic: Tom, Dick, and Harry. From medial to lateral side, the structures passing below the flexor retinaculum are tibialis posterior, flexor digitorum longus, artery, nerve, that is posterior tibial artery and tibial nerve, flexor hallucis longus. And this is flexor retinaculum, that is connecting between medial malleolus and medial part of the calcaneal bone. So this is preventing the popping up of these tendons and increasing their efficiency during their contraction. And this is popliteal artery. You are aware of this, and these are the branches of popliteal artery. The tibial artery continues from the popliteal artery, and it is divided into posterior tibial artery and anterior tibial artery. Anterior tibial artery goes to the anterior compartment, and this is peroneal artery, which goes to the lateral compartment, or fibular artery. Peroneal artery, and this is posterior tibial artery. That is the one which supplies most of the muscles of the back. You can see it again here. This is anterior tibial artery, this is posterior tibial artery, and this is peroneal artery. The sciatic nerve has two branches, that is common peroneal nerve, and this is the tibial nerve. Tibial nerve continues down, and it lies it goes below the soleus, and it lies in between the tibialis posterior and digitorum longus, and along with the tibial nerve we find posterior tibial artery. This is the course of tibial nerve. This is the one which supplies all these muscles. So this, you can see the branches of tibial nerve supplying all these muscles. To mention few applied anatomical aspects, soleus is also known as peripheral heart. The muscle soleus has some venous sinusoids within the muscle mass. There is some amount of blood within this muscle always. The constant walking or action of soleus will push this blood out of it into the circulation. That's why soleus is known as peripheral heart. In long-standing bedridden patients, say after major operations, the deep veins of the leg, especially in the posterior compartment, can go for thrombosis. Blood gets clotted, and that can dislodge and can go to heart and lung, causing pulmonary embolism. So deep vein thrombosis is one more important clinical aspect to be mentioned when we learn back of leg. Though it is very strongest tendon, Achilles, it can get ruptured during some injuries or levator pan injuries. Indian style levator pan injuries can cause damage to Achilles tendon. So these are the few applied anatomical aspects. This ends the class. Thank you.